Just want to introduce myself. My name is Lianne Jemelian. I am the Health Services Coordinator and District Nurse for the Menlo Park City School District. And in my role, I have the privilege of working with food allergy families at all stages of their food allergy journeys across many stages in the elementary and middle school grades. I also collaborate with my counterparts at the Sequoia Union High School District to ensure that students across all ages benefit from the highest level of care. To kick off tonight's discussion, I wanted to share a story of a food allergic teen that I recently learned. These are her mother's words. Since my daughter was diagnosed with severe peanut allergy at 18 months old, we had countless scares and almost annual trips to the ER. Just micro traces of peanut triggered the dreaded reaction. When we learned about the treatment with oral immunotherapy from a friend, we knew we had to take the chance. Recently, we had a reminder on how our family's lives have been transformed with treatment at Latitude Food Allergy Care. My senior year high school daughter accidentally ate peanuts mixed in a Burmese appetizer for lunch, and we were worried as she ate a significant portion of it. Sigh of relief once we realized that she didn't have any reaction. For the first time since before treatment, she didn't have to use her EpiPen, although we had it on hand. And more importantly, we didn't have to go to the ER, all thanks to completing the Latitude program. The greater peace of mind from treatment is priceless. Knowing that my daughter could tolerate so many peanuts helps me sleep better, especially when she's getting ready to go to college next year. So I've been hearing more and more transformative stories like these from families in our schools, and I'm grateful to offer this important conversation to our whole community. It's my pleasure to introduce allergist Dr. Rani Maskatia of Latitude Food Allergy Care. And Dr. Rani and Latitude are helping families navigate their food allergy journeys with accessible and complete food allergy care at their flagship clinic in Redwood City. She's eager to share the newest approaches to managing and treating food allergy for teens. Hello, Dr. Rani.
Hi, thank you, Lianne. All right, well, thank you for joining us this evening. We'll be giving a talk on just food allergies in specifically the teenage population, and I'm happy to answer any questions after the presentation. So I always just like to start by talking a little bit about the prevalence of food allergies, just because it is pretty striking. The prevalence is definitely increasing. Current estimates suggest that about 1 in 13 kids actually has a food allergy, which translates into about 2 in every classroom. We know that the incidence of food allergy and food-induced anaphylaxis has increased over the past 20 years in the US. And in fact, about 40% of kids with food allergies will actually suffer a life-threatening reaction at some point. So in part due to that fear about a severe reaction and accidental exposure, we know that kids with food allergies have increased rates of anxiety and depression compared to their peers. And we also know that their quality of life is significantly impacted by their food allergies. However, traditional food allergy care is often insufficient. So I see a lot of patients with inaccurate or incomplete diagnoses, which really leaves them very confused. There also are a lot of patients who are just given overly broad recommendations to avoid whole food categories. So for example, if a child is allergic to peanut, they're often told to just avoid all nuts. But of course, that does create an unnecessary burden on the families. We know that patients are often unaware that treatment options exist, and I'll talk about those a little bit later in the talk, or have perception of limited access. And we know that teenagers and adolescents in particular are higher risk. This is the population that's just less likely to carry epinephrine, to take more risks and potentially eat just small amounts of their allergens thinking that that'll be okay. And they may not even recognize the signs of anaphylaxis, especially early signs. So this group in particular is one that we do tend to worry about. And we know that this inconsistent food allergy care just contributes overall to anxiety and burden on families with kids with food allergies. Next slide, please. Thank you. So here at Latitude, our goal is to try to solve this problem. So we do offer lots of things, including access to proper testing, accurate diagnosis. We also give treatment options. And one kind of unique aspect of Latitude is that we do also offer this maintenance care and access to patient care coordinators. These are families who have kids with food allergies themselves, and so they've gone through this and are a great resource. We also offer things like nutrition support, and we can even partner our patients with food allergic peers if they would like to talk to someone that's gone through a similar experience. Next slide. So I do want to spend a little bit of time just talking about the diagnostic process, because this is really central to everything that we do here at Latitude. So the first step is always going to be to take a very detailed clinical history. This is probably the most important part of the entire diagnostic process, because even though we have testing, we have skin prick testing, we have blood testing, it turns out that allergy testing overall is just not very good. We get a lot of what we call false positives. So the testing can often be positive even when an allergy is not present. That's why it's really important that you have someone with a lot of experience look at these tests in the context of the history to really try to determine whether a true food allergy is present. And if there's a question, we will often do oral food challenges. And I'll talk about that in a little bit more detail, but basically we introduce the food in the safety of our clinic to really be able to tell one way or the other whether an allergy exists. And in fact, 80% of the food challenges that we do at Latitude are passed. That means that this person does not have a food allergy and they can safely eat those foods that they were potentially avoiding. On average, our patients can add back about 3 foods into their diet. And this really does give patients just more clarity on their allergies. It also informs treatment options. And really, in and of itself, food challenges, they really can be life-changing. For example, last week, I actually did see a teenager. She's 13, and she was diagnosed with a peanut allergy when she was just a baby. And because they were just told year after year to just avoid and carry EpiPens, they just stopped going to the allergist. And finally, I saw her after several years, and we updated her testing. And lo and behold, she actually seemed to be one of the lucky kids who outgrew her peanut allergy. This is not a common situation. Most kids do not outgrow peanut allergies, but some do. And she was actually able to pass a peanut challenge. And now she is free of her allergies. She does not need to carry EpiPens. So of course that was completely life-changing for her and her family. And so we do recommend that allergy testing be updated on a regular basis because allergies do change over time. So overall accurate testing and diagnosis can just give patients clarity and relief. Next slide, please. So how exactly does an oral food challenge work? So basically what we do is we start by giving super teeny tiny amounts of the food in the clinic, and about every 15 minutes, we increase the dose. And our goal is to actually give a full serving size of the food while you're in our clinic. And then we actually watch patients for about an hour to an hour and a half afterwards, just to be absolutely sure that there's no reaction. So the whole process does take a while. It takes about 3 to 4 hours in general. Now, if someone passes a food challenge, that is great. It means that they don't need to avoid that food anymore. We can help expand their diet. We can improve their quality of life. However, even when the food challenge is not passed, it really gives us a lot of valuable information. It shows us what the threshold of reaction was, how much food was needed to cause the reaction. And it also gives us an opportunity to really teach families how to recognize and treat reactions, because this is something that a lot of families really are very stressed out about. To see it in real time with, an allergist present, it can be actually really reassuring and be a great learning opportunity. And so that's something that, actually can be a benefit even when the food challenge doesn't go as we hoped. And we do have a lot of appointments for food challenges. This sets us apart from other allergy clinics. We focus entirely on food allergies, and so we do have more availability in general for these types of appointments. And so, that is an advantage that we can offer. Food challenges also can help prepare patients for oral immunotherapy if they're going to be doing treatment. And so that's another advantage that oral food challenges can offer. Next slide. So once the food allergy is established, at that point, at Latitude, we will sit down with you and kind of go over all of your treatment options, okay? And one of the things that we do offer at Latitude is oral immunotherapy. So this is a desensitization process. What that means is that we actually, through this process, try to teach the body to no longer react to the thing that it's allergic to. We do this by giving very, very small doses and very gradually increasing until we get people eating the food that they're allergic to, ideally with no allergic reaction. The first 6 to 9 months of this process do require frequent clinic visits. But after that, the goal is to get them eating the food that they're allergic to and just continue daily dosing in the maintenance phase. So that's what the treatment looks like. 92% of our patients actually are able to achieve desensitization to their food allergens. We treat all patients, okay? Even the most sensitive patients can be treated usually simultaneously if they have multiple allergens. At a minimum, this will protect against accidental exposures. And of course, we use evidence-based protocols from very I have to say, no medical treatment is going to come without risks. And so there are potential side effects from this therapy that we would want to review with you if you do decide to pursue this therapy. But overall, OIT can really empower patients. And that's why we want to just make it more accessible to food allergic patients. Next slide. So overall, oral immunotherapy can just improve quality of life. It leads to decreased levels of anxiety, improved variety in the diet. It can improve social and emotional well-being. Because it protects against accidental exposures, it really just gives patients more confidence when they go to eat at restaurants or when they travel or when they go to parties. And so that is really something that just gives them more freedom, with high school and beyond. And next slide. So the last slide is just one focusing on some of the things that we've heard from our patients, that are teenagers with food allergies. So one myth is that it's too late to have updated testing and be empowered with their food allergies. There's maybe this idea that this treatment does not work in older kids or that older kids are going to be too severe. And I just do want to say that that's actually not true. The majority of food allergic teens are eligible for treatment. The one factor is that they have to be motivated. Okay, I will say that we do need our patients that are teenagers to really want to do this for themselves, and really that's going to determine whether they're successful or not. So we've treated many, many patients, including many teenagers, with this therapy, and we have been able to treat multiple food allergies at the same time. So those teenagers that have many food allergies, this does not necessarily mean you're going to have years and years of having to come into the clinic every 2 weeks or so. We can treat multiple allergens at once. And we do try to give ways for teens to feel empowered through this process. For example, we have an app that we can actually download to someone's phone, which allows them to enter their doses, any issues that they might be having, and really just helps empower them, throughout this process, and just gives them ownership of the process. And so overall, 90% of the families that have done OIT with Latitude would do it again. And so I'm going to stop there and just introduce Kim Yates, who is the CEO and founder of Latitude, and someone who has actually dealt with food allergies in her own family. And so I'm happy to turn it over at this point to her.
Thank you, Ronnie. Super helpful. And Lianne, I just want to special shout out. Thank you so much for creating this platform for us to be able to speak to the community, to the Menlo Park Sequoia community. I am the mom of 3, and all 3 of my girls went through the Menlo Park school system. And I have said this to Lianne many a time. I wish I had known her, and I wish she was there when my girls were in elementary school. My oldest daughter, I have Tessa, Reese, and Alyssa. My oldest daughter, Tessa, who's now 20. She was born with multiple life-threatening food allergies and had 4 nearly fatal reactions. So like those of you on this call, I know what it's like to send your child to school every day and worry if they're going to be, if your child's going to be safe at school. We were very fortunate to be able to enroll Tessa in a clinical trial. She was the first child to be treated to multiple foods at the same time at Stanford. And, we are incredibly grateful, and it was incredibly life-altering I love this picture that Debbie put up here. It's Tessa getting ready to get on another airplane. And the treatment was so successful that Tessa has been able to travel the world and by herself. And that's, like Ronnie was saying, there's so many different ways that this can change a family's lives, and birthday parties, restaurants, but also travel, which is incredibly important. When it was so successful for Tessa, it became a mission of mine to make sure that everybody had access to this care. No child should be afraid of travel. No person should be afraid of travel because of food anyway. So made it our mission to take what we were doing at Stanford and make sure that this care and treatment was accessible to all families living with food allergies. So in 2018, we opened our doors in Redwood City. Latitude is 100% focused on food allergies, so we're slightly different than a traditional allergist that might spend a lot of their time on airborne allergies, environmental allergies, allergy shots, asthma, allergic rhinitis. We're different at Latitude in that we only focus on the diagnosis and treatment of food allergies. So we're excited to be able to offer just a very, as Ronnie said, a large breadth of services in order to support food allergy families. And it's pretty unique. It's a clinic that was started by food allergy patients for food allergy patients. So our hope is that when you walk through our door, you feel that sense of, okay, they understand me at Latitude. And they understand what our needs are. So like I said, we opened in Redwood City in 2018. We have 4 clinics around the Bay Area now, and we actually recently opened in New York City. So we're really excited to be able to expand and hopefully expand across the country here over the next several years. So with that, I'm excited to turn this back to Lianne, who's gonna host a conversation with Megan, who I've had the pleasure of knowing for many years. I got to watch Megan go through her treatment as well. And I'll let her tell you how life-altering this treatment has been for her. But Lianne, and thank you again, Lianne, for hosting us and making sure that all of these families have access to this information. We're really, really grateful.
Thank you so much, Kim. Appreciate that. I would like to introduce Megan, and Megan is a graduate of Palo Alto High School, and she's currently a senior at Sonoma State, and she is happy to share her food allergy story in hopes of empowering other young adults just like her. Hi, Megan.
Hi, Lianne.
Thanks for joining us tonight.
Of course, happy to help.
Great. So first question I have for you is, often when we talk with parents, they can describe in great detail their child's first allergy reactions as if it happened yesterday. What are your earliest memories of having food allergies? And are there specific emotions you associate with that time of your childhood?
For me, the earliest memories I have about my food allergies is when I was a toddler and I would be served my food before anyone else in my family. And after that, I would be placed outside the kitchen in the family room with a little baby gate, so I wouldn't have to be contaminated by the rest of the food in the kitchen. And between that and also my life in elementary school, some emotions I remember are just a lot of isolation, between, even that example, between me and my family. I wasn't able to sit at the table with them. With me and my friends, I'd go to a birthday party. I would often either eat beforehand at my house, or I have to eat separate food from everyone else, and just felt very isolating and separated. Also a lot of anxiety surrounding food and if I would be safe going over to a friend's house or to a birthday party or a school event, whether or not the food would be safe for me to even be around, because eating it was going to be out of the question. So just a lot of those very anxious, isolating emotions.
Wow, okay. I understand that you, like Kim's daughter Tessa, were also an early participant in a clinical trial for oral immunotherapy at Stanford. How old were you at that time, and what allergies were you treated for, and did you have any hesitation?
So I was treated for multiple food allergies. I was treated for peanut, milk, egg, and soy. And I was 11 years old at the time. I'm 22 now, so it's been 11 years since I started this journey. And I don't remember having many hesitations. I was just extremely excited to have the possibility of, being safe around foods for once, and just trying all these new foods I never would have dreamed of eating, or even just going to a restaurant with my family and being able to be around the food. That was just a very exciting time for me. And I also, had a lot of trust in the doctors. And so I didn't have a whole lot of hesitation because I knew that if something were to happen, that they'd be able to keep me safe.
That's great. What did high school look like for you in terms of your food allergies after you had been treated with oral immunotherapy?
So going into high school, I'd been on my maintenance for a few years, and since I'd been treated with OIT, I felt a lot of confidence going into high school. I was able to sit at a tight table around a lot of other kids, and I didn't have to worry about the kind of food that they were eating. If it was something I was allergic to, if something would fall on me and I would, break out in hives. I also was able to go out to restaurants with my friends, go to, birthday parties, prom, things like that, and like be able to be around the food and even, eat some of the food that was there. So the anxiety and isolation I felt as a younger kid in elementary school went away after my OIT going into high school, which was a very, pivotal time in my life.
Very life-changing.
Mm-hmm.
So now I know you're nearing the end of college. Did food allergies influence your college choices? And what tips would you have for young adults managing food allergies in college?
My food allergies in college, I don't think they really influenced my college choices because after going through OIT, I felt confident that I would be able to eat in any college cafeteria and feel safe and confident in eating any of the foods that maybe I wouldn't be able to before, or just the idea that cross-contamination wouldn't be an issue for me. So that kind of really opened my doors to, any college I really wanted to go to, which was awesome. I remember kind of in middle school or elementary school thinking, oh, college might be difficult with, food allergies and just life in general. And so after OIT, I felt really excited and confident in going into college because, I knew that I would be safe with the foods that I was eating. And advice I have for kids in college, managing their food allergies, is to contact the faculty that work in the food services and get in contact with them, form a relationship with them, because those are the people that are going to be helping you out and know the food system the best at that school. And so those are the people you really want to have on your side to make sure that you know the foods you can eat, the process that they go through, and if there's any things you want to see changed in the cafeteria to make it safer for you and for others, or anything you want to see added, like you would reach out to that faculty to really have control over the situation.
It's really good advice. Since you were treated many years ago, what does your long-term food allergy care look like?
Well, now I am lucky enough that I'm able to freely eat egg and soy, which were 2 out of my 4 food allergens I did OIT for. And so that has really opened up a huge door for me. I mean, I didn't even really realize how much egg and soy were in products that, we eat every single day. And until after I've been able to eat as much as I want, it's just been so relieving. And those are products that, are in everything, and I don't have to avoid them or limit myself on them, which is really great. So, I'll have eggs for breakfast. I'll go out to sushi with friends and have as much, soy as I want, which is great. And I'll keep milk and peanut in my diet as well, probably once or twice a week. So I have a lot of freedom with the foods that I eat, and I just try to make sure that I maintain those foods in my diet to create my rate or continue my sensitization.
That's great. Okay, and a big final question. What do you think your life would have been like now if you hadn't done OIT, oral immunotherapy?
I think my life, if I hadn't had OIT, would have been incredibly different. I don't think I would have been able to do the things I've done up until now. I think college would have been a struggle. I was able to study abroad, and I don't think I would have been able to study abroad if it wasn't for OIT. There's so many opportunities that OIT, helped give me that before OIT weren't even on my mind as something that I thought I would be able to accomplish.
It's amazing. It's amazing. Thank you so much, Megan, for sharing your story with us. It was wonderful to meet you.
Of course, thank you so much.
And now what I'd like to do is reintroduce Debbie Taback, who's going to handle our Q&A session. So please feel free to add questions.
Thank you so much, Lianne. And Megan, every time I hear your story, I learn something new. So that was amazing. Thank you so much for sharing it and sharing all those, all those details. We do have some questions that have popped up in the chat. And I know I also asked some, registrants if they had questions ahead of time. And I'm hoping Dr. Rani and Megan and Kim Yates, if you guys each can just turn your video back on, and then we can kind of do a panel of a few questions I have for each of you. Dr. Rani, here's a big one. My child is heading to college in August. Is there anything that can be done for her food allergies now, or is it too late?
So that's a great question. So overall, absolutely. As I mentioned before, the vast majority of teens are going to be eligible for OIT treatment. And so, of course, the first step would just be to do that, visit and make sure that we have an accurate diagnosis. And then go into potentially treatment. So usually in our teenage population, it takes about, depending on the food, anywhere from about 6 to 9 months to get up to maintenance. Now, there are some patients where we're not able to get them fully to maintenance by the time they head off to college. That usually does not end up being too big of a problem. What we'll do is at least try to get them maybe halfway there. And then anytime they come back for their holiday breaks and things like that, we would try to have them come into the clinic to do an updose during those times. And so usually we're able to get them, even if not fully to, where we want them to be, we're able to get them to have a meaningful amount of protection by the time they would leave for college.
Okay. Well, then that leads me to a question for Megan. During college, I think you were still dosing. I mean, it sounds like you are still dosing very long term. What does that look like in college to be dosing?
For me, I kind of will look at my schedule and see what kind of classes and events I have going on throughout my day, and I try to see what times I can carve out that 2 hours before, 2 hours after. I still like to keep that window because most of my reactions when they did happen would be within that 2 hour period. So to be safe, I always keep that 2 hours before, 2 hours after. And that hasn't been a huge struggle for me. I've been very involved on campus. I'm in a sorority. I have, a lot of events, a lot of classes I go to, but I've still been able to find time to dose throughout my week. So that's, it's been really manageable.
And then Kim, does Tessa still dose? What does her eating and dosing look like?
Tessa just eats regularly at this point. She makes it a point to get foods, to get all of the foods that she was treated for into her diet. But, and I just want to disclaimer, not everybody has the same story. And as you can see, just even between Megan and Tessa, some of Megan's foods she can eat freely. Some she's still making sure that she's getting in on a very consistent basis. Tessa is not having to do that as strictly. She is able to eat the foods that she was treated for at any level and at any time.
Ronnie, did you want to add anything? to that?
Yeah, I will say that it does depend. Obviously, as Kim mentioned, everyone is unique with regards to this. And I will say that people that are on the earlier side of their treatment do need to be much more regular with their dosing. And then as time goes by, that's where we can potentially make some adjustments to the dosing. But in the beginning part of the treatment, absolutely, we do recommend that this is going to be something that you do pretty much every day. So for people that are just starting out, it will be kind of a little more strict and consistent. And then down the road, years and years of therapy, that could obviously change.
Megan, I have another question for you that I know you touched on a little bit when Lianne asked you if you were hesitant at all in starting the clinical trial. Someone wrote, I want my son to do OIT, but he's too scared and not interested. What suggestions would you have if you were speaking to another teen who had some hesitations?
Something I would say is, I definitely understand where, these people are coming from, because it is a very scary thing to think about. You're told all your life to stay away from these foods, and now all of a sudden you're getting told to eat them, which is very contradictory. But what I, would tell someone is that the people doing your treatment, they are trained in this. They know how to keep you safe, and they only give you the amounts that would be safe for you. And, they have these precautions in place, the 2 hours before, 2 hours after, to make sure if you were to have a reaction, that it would happen at the clinic and you would be, well managed. And I just like to, think about where your life is now, and, think about any restrictions that you have, and think about how you would want them to either be improved or different. And see, OIT likely can do that. If you are having a lot of anxiety around food, going through OIT really helps you get rid of that anxiety around food, because you don't have, you have a wall built up of, levels that you can take. And, like I said before, it opens a lot of doors for travel, like me and, like Tessa, things that, you wouldn't think that you'd be able to do. And so I think that even though it might be scary in the moment, to kind of think more into the bigger picture of how it would improve your life.
That's good, thoughtful advice. Clearly coming from experience. Thank you, Megan.
Debbie, I just might add just a reminder that so many of these kids that have been through oral immunotherapy before would be absolutely happy to speak to any teens that are considering this, any teens that are, or any child, anyone that's considering it. I know some of these kids that have gone through oral immunotherapy would be happy to talk to them, because sometimes talking to their peers is the best support that they could get.
Absolutely.
Yeah. I was just going to reiterate exactly what Kim said. This is something that the person going through the treatment really needs to be motivated. Okay. And so I just like to make a point about that, because I know there's a lot of families that want their children to do this therapy, to get them protected before they go off to college. But it's extremely important that the teenager themselves wants to do this, because once they head off to college, they are the ones that will be managing this in most cases. And so we really want to make sure that they are on board, that they are motivated, and sometimes talking to a peer that has gone through the process can be really helpful in that type of situation. And that can sometimes work better than parents just directly talking to their kids in this group.
I'll just add that I'm a parent of 3 teens, and I fully agree with that statement. So.
And Debbie, I would say sometimes the teens, because they're so nervous, they can't see this working for them. So, and they don't want it to fail. They don't want to fail at it. They don't want to try it and have it not work. And they, it's a layer of protection that they put up, and a guard that they put up, and they say, I don't want to do it. And sometimes kids are feeling like it's not going to work for them. And if they, so they can't think of life beyond oral immunotherapy. And they also have a lot of a lot of their identity is wrapped up in living with food allergies, and this is what they know, and change is hard. But oftentimes, talking to other teens that have been through it, and again, yeah, not to reiterate again what Ronnie said, but talking to other teens can help them come to it on their own, because they really do need to come to it on their own.
I agree. Dr. Rani, we had a few questions I'm going to kind of batch for you. They're really focused on like what works, what might not work. And so there was a question of whether there's better success rates for single allergen versus multiple allergen. Can fish be treated? And there was one other that was similar to that. This is a longer desensitization type question. Does it actually help kids to incorporate specific allergens, or does it just minimize the severity of allergic reactions? So you can, that's a big group of.
I've already forgotten the first question.
Very specific. Yes.
So I'm sorry, I remember the fish one, and I already have forgotten the first question.
Single versus multi.
So yeah, let's start with that. So
like the level of desensitization.
Got it. Yeah. So basically, with regards to the multi versus single, it's a good question. And, Stanford in particular is the institution probably with the most experience when it comes to multi-allergen oral immunotherapy. Does it work? Yes. As Kim and Megan just mentioned, they actually had experience going through these protocols. So the studies that have been done do seem to indicate that treating multiple foods at once has a similar efficacy and a similar rate of reactions as compared to treating one allergen at a time, which is why we offer multi-allergen OIT at Latitude. Now, that being said, every person is unique, okay? Rarely, I would say it's very rarely, we have someone that doesn't do well with the multiple allergen OIT, and we end up separating their allergens out. It's actually a pretty unusual situation for us to have to do that. The vast majority of our patients are able to do multi-allergen and do it successfully. And the huge advantage, of course, of doing multiple allergens at once is that it is so much more convenient. Because if you did every single allergen separately, that's 6 months of coming into the clinic about every 2 weeks. That could be years and years we're coming into the clinic every 2 weeks. So of course the convenience factor is huge. And so honestly, in almost all cases, I will actually recommend we at least try to do multiple allergens at once if multiple food allergies are present, just because of how much time and effort it really saves the families. And so that's kind of, how I approach that. With regards to the level of desensitization, so I will say that, again, as with most things in medicine, it is very unique. So the teenage population in general, I will say, when you've lived with an allergy for a long time, a lot of times they actually don't end up loving the taste of their allergens. And so for a lot of our teenagers, they really do seem, especially for peanuts and things like that, they really do just seem to want kind of the minimum amount to provide protection against accidental exposures. And they don't really have a desire to eat a peanut butter jelly sandwich, for example. That's very different in the young kids we treat. A lot of our really young kids do not have taste aversion. They love peanut. They want to eat peanut butter jelly sandwiches. And so we really kind of cater this treatment based on goals. Our first goal is always getting to safety against accidental exposures. And so that's going to be what we aim for, especially in our teenage population. That's going to be our first goal, okay, is just getting to kind of that safety level, which is around 1 to 1.5 peanuts or so when it comes to a peanut allergy. Now, for allergens like milk and egg and wheat, a lot of people do want to actually incorporate those foods into their diet. So our goals are usually higher for those particular foods. And so in general, for milk, it would be around a cup of milk. For an egg, it would be around an egg. For bread, maybe a slice of bread. So those actually are meaningful amounts that actually do change someone's diet. So again, depends on the person and how much they want to eat. And also what the food is, that we're treating. That's where we really have just a conversation with the patient, their families, to really try to figure out what your goals are and try to aim, the therapy towards those goals. The last question was about fish. So fish is tricky. We do offer fish oral immunotherapy. It does work. I will say it is more difficult to do as compared to some of the other foods that we treat. It's less studied as well. So fish oral immunotherapy, it looks to be kind of species specific. So what that means is that if we treat with salmon, it doesn't necessarily mean now you can eat halibut and codfish and all these other fish. It means you can eat salmon. And so if that's a big priority for some families, it is, we are more than happy, to do salmon oral immunotherapy. But remember, with oral immunotherapy, there is at least several years of daily dosing, which can be very tricky with fish because, people travel. And so you always have to think about, how am I going to get that daily dose in? And so it has been tricky. So we have had a handful of patients be successful with fish oral immunotherapy, but in full transparency, it is more difficult to do than some of the other foods, and there isn't as much experience with it.
Gotcha. Okay. I think you answered this.
Okay.
Totally, you remembered all the questions. That was awesome. Okay, and I think we'll have another kind of tangent off of that.
Sure.
I did want to go back to a question that came up when Megan mentioned her, her story, and I don't know if Ronnie or Kim, if one of you wants to address that there is a time, like a rest period around, maybe Ronnie, you can speak to the medical side of what we recommend about a rest period around dosing. And then Kim, maybe you can address what does that look like in a busy teenager's life?
Absolutely. So there are certain restrictions that come with treatment with oral immunotherapy, because of course we are giving someone something that they're allergic to. And so we do need to do this in a safe way. And we know that one of the things that can potentially cause an allergic reaction and decrease the threshold for a reaction is exercise. So anything that increases the heart rate, anything that increases the body temperature, these are things that we watch out for when we do oral immunotherapy. And so the general recommendation that we have is that for 2 hours after taking the oral immunotherapy dose, we don't want someone to elevate their heart rate or increase their body temperature. So that would mean, no strenuous activities, even no hot showers, which can be kind of a big deal for some teenagers. And so those are restrictions that we will recommend. Now, everyone does have a different degree of how sensitive they are. Megan was a more allergic person, and so she actually requires 2 hours before taking the dose, it sounds like, as well. That's not a usual situation, but sometimes we will need to have a bit of a time before giving the dose as well, where we don't want to do any kind of increased activity or elevate the body temperature. And for some people, 2 hours may not be enough. They might need a little bit longer. Some people might need a little bit less, but in general, we recommend 2 hours as the minimum for a rest period, or for those hot showers, anything that could elevate the body temperature. So those are the general recommendations that we make.
Yeah, thank you for clarifying that. And then Kim, did you want to address how would that fit into a busy, you have 3 teens. I think you mentioned that when you introduced yourself.
I mean, I think what I love about Megan's story is Megan's made this her own, and this is her story. And you have every teen that does this ultimately comes up with their own schedule and what works for them and what makes them feel the safest. There's no, if something makes you feel safer, there's no right or wrong. There's some recommendations that we have. I think sometimes people think rest period and they think, oh my gosh, I have to sit in a chair and I can't move for 2 hours, which is just not the case. We don't want kids going out and, going and doing soccer practice after they take their dose. And, but they can sit, they can move around. They don't have to be laying horizontal, flat, no movement, watching TV or something. So, the one thing I would love to, stress is that we can find ways, and that's what we can do, is work with you to help you find ways to make sure you can fit this into a busy schedule. It's hopefully for a limited amount of time that you're going through this. So hopefully, again, I just want to stress that, you know, we don't want to scare people off from the rest period that we recommend. We just want to make sure that people are safe, and we're happy to help work out different ideas of, you know, taking it after sports, taking it after dinner, taking it while they're doing their homework, you know, having the rest period while they're doing their homework. You know, teens, we know teens in the Bay Area are doing lots, you know, at least 2 hours of homework every night. So, you know, it's a great activity to do while you're after you've taken your dose. So,
and without jumping into the panel myself, because I one of the hats at Latitude that I wear is as a patient care coordinator, and those are the types of questions that are not medical specific questions, but really can be answered in a very helpful way from other families that have gone through this experience. And we have the benefit of a lot of those to speak with you. So Ronnie, I want to jump back to one more medical question about OIT for tree nuts. Do you treat each nut separately, or are there combinations?
Yeah, so luckily for tree nuts, there are some cross desensitization patterns that we can take advantage of. And I will say, you know, I see obviously lots of kids with tree nut allergies. There's always at least a couple of tree nuts that kids are just absolutely not allergic to. So usually we can just cross some off just by doing food challenges to the ones it looks like they're not even allergic to. But we know that cashew treatment will cover for pistachios, so we don't need to necessarily treat with both of those nuts. We know that walnut offers coverage for pecan, and even in most cases for hazelnut. And so yes, there are some cross desensitization patterns, which means that we do not normally need to treat for 10 tree nuts, for example.
That's great. And I do want to address, someone had asked
the ones that you do need, you can treat them at the same time.
Yes.
Good point. And is there a limit to how many we'll treat altogether when we talk about multiple allergens?
Yeah, that's a great question. In general, I will say that we try to keep it to 5 or less. I have made rare exceptions, especially for patients that travel quite a distance to come see us, and we have done a couple more. But the fact is, you know, when you start to go above 5, it gets quite difficult to do this because, you know, there is a daily dosing. It gets to be kind of especially for younger children, it gets to be quite a bit of food. And so in general, we do try to limit it to 5 foods or less when we're doing multi-allergen oral immunotherapy. On a case-by-case basis, I might deviate from that.
Thank you. Megan, I had one more question for you. I know, you know, Kim had alluded to as kids get older, you know, or maybe Ronnie had mentioned that if you start the process a little older, sometimes you can have taste aversions. And you mentioned you're free eating to a couple different allergens, but you still, you know, just regularly keep the other 2 in rotation as doses. Is there a particular food that you are just so excited that you can eat safely now?
I mean, the soy and egg is really probably 2 of my favorites of the ones that I can eat freely. I mean, I love going out to sushi, so like having you know, like the edamame and the soy sauce, as much soy sauce as I want, instead of having to, you know, be cautious about like measuring it out. So yeah, those are really great. I'll like go to breakfast now, and you know, when people used to ask me if I wanted to go out to breakfast, I'd be kind of like, there's not a whole lot of breakfast foods, a lot of eggs. But now I feel comfortable going to a restaurant, ordering eggs for breakfast and feeling good. I'll still a lot of times ask, you know, restaurants to not cook my food in butter and to use oil instead because of the milk, because I'm a little bit more sensitive to milk. But you know, if there were some butter that was cooked in my food, then I'd be safe.
So great. It's so great to hear. And Kim, is there a favorite food of Tessa's, particularly now that she's traveled the world and eaten all kinds of things?
She loves all the foods. I mean, the funny thing is that she loves peanut butter. And I know that's one that can often be an aversion, but she, you know, loves peanut butter and eats it every day. And I mean, who doesn't love ice cream? So I think the most important thing is that she has normalcy. And that's really what we oftentimes just, kids oftentimes strive for, is just normalcy. It did take her a good 8 years to want to eat eggs. And now she orders eggs, because that just psychologically, she couldn't get her head around eating eggs. But now she loves them. So sometimes it takes longer. Sometimes they like it right out of the gate. But I think just, to achieve some level of normalcy is really an amazing feeling.
So great. That's so great. I did want to also address, there was a very practical question about, and this really goes to the heart of, this needs to be accessible for families, and that's the Latitude mission, is to make this accessible. So someone asked about the costs involved and if treatment is covered by insurance. So Kim, do you want to address that question?
Sure. We do take insurance at Latitude, and which was very important to us. If a patient, so all of the visits and all of the diagnostic process are covered by insurance. If we find that a child is allergic to foods and they enter into oral immunotherapy and we start treatment, there is a program fee that is associated with just the costs of running the treatment and we do offer 24-hour access to medical care. But for the most part, like I said, all the visits and all of the diagnostic process are covered by insurance. But only when you start the treatment are there costs associated, out-of-pocket costs associated.
Right. I of course knew the answer to that, but I wanted to moderate versus sharing. And I will just add that program fee, if you were to go through oral immunotherapy, is a one-time cost, not a continual in perpetuity kind of a cost. So we do try to make that manageable and accessible for families. So. And I think we are just about hitting time. I could talk to the three of you for a long time about all of these topics. I'm just going to check to see if there are any other last questions. And it looks like there are not. I'm hoping my other colleague, Kim, can throw up the very last slide that we've pulled together on ways that you can learn more and stay in touch, learn more from Latitude. And there's a picture of Megan. Thank you for sharing that photo, enjoying a really lovely looking dinner. But we host once a week, we host an office hours and open office hours with one of our patient care coordinators. Julie leads those, where you can just come and ask questions about OIT. Those are non-medical specific questions, of course, but it's an open group that you're welcome to join. We have a Facebook group, and we have our clinic in Redwood City would be the closest for all of the people attending on this talk. And I will send a follow-up email to everyone who had registered with links to these resources as well as the recording of this talk. So thank you all so much for joining us tonight.
Thank you. Thank you everybody for joining. And again, Lianne, thank you so much for linking us to this community and sharing this resource to all the food allergy families. We're really grateful.
Thank you all. And I think it was wonderful. And I hope more people get to enjoy this and listen to you all. This was extremely helpful.